Hello, everyone. Thank you so much for coming to this presentation today. My name is Taya, and I will be your presenter. I just wanted to say a special thank you to all of the medical staff out there for your continued dedication to keeping our community safe and healthy for the potential of needing to uproot and go to another state for this upcoming flu season. Our goal today is to help the staffing agency to identify any states that are in need of additional medical staff for the upcoming season. And we're going to do that through highlighting different trends in the seasons, different locations, and looking at various populations in there as well. Because as we know, the flu season is a real thing. Approximately 45,000 people die every year from the flu. Now, the data we're going to be looking at is gathered from the CDC and the U.S. Census Bureau from 2009 to 2017. Before we dive into the data and the presentation, I just wanted to go over a couple limitations of the data. I know for myself, as I'm listening to things, sometimes my brain starts to whirl up and think of other possibilities and solutions. So sometimes it's nice to know some of those limitations before we dive in. Number one is that the data is at a state level, not a city or a county level. Number two is that the data from the CDC, when it comes to death counts, anytime there was a death count that was between 0 and 9, those counts were suppressed to protect the identity of those individuals. So the data we're looking at today is actually most likely an underestimate of the actual death counts from influenza. Thirdly is that when it comes to identifying the death of an individual, there was no opportunity to recognize if there was any contributing factors, any underlying health concerns for any of those individuals. And then lastly, I did not, unfortunately, have any data on vaccinations. I only had a small amount for individuals under 18, and it was not exactly complete. So for the sake of this presentation, we're not going to be identifying any vaccination rates or anything like that. Okay, let's go ahead and jump on in. The first thing to identify is that, yes, in fact, there is a flu season. It is not an old wives' tale. Starting in November, going through the end of March, is the flu season in those winter months. In fact, it peaks in January. So when we start to think about the rollout of sending staff members out to help additional states, that is kind of the time period that we're talking about, those winter months. So as I started into the analysis, some of those big key questions I was looking at is, are there any vulnerable populations? And to identify that, the first thing I did was really kind of look at some age bands and looking at the total death count. And as we can tell in this first visualization, is we really start to get much higher death counts in those older age brackets, specifically in that retirement age. So 65 and older, we have a much higher death count. And looking at it a little further, that 65 and older is nearly 400,000 deaths from 2009 to 2017 in comparison to that younger age bracket where there's only about 40,000 deaths. If we delve into that math a little bit more, that means that on average, individuals over 65 are 64 times more likely to die from influenza than those in the younger age bracket. And when we look at that over the span from 2009 to 2017, that stat kind of holds up, right? Individuals were anywhere from 45 to 100 times more likely. So when we have officially identified the demographic that we're going to be looking at throughout the remainder of this presentation, and this is what we were calling that vulnerable age group. So the next thing that I wanted to look at was to really identify if population had a factor in it. Now, what we looked at was identifying if you were in a more densely populated area or state, did that increase your chances of passing away from influenza? And one of the things that we looked at, one of the tools that we used is something called a correlation coefficient. Now, a correlation coefficient is a fancy way of looking at the strength between the relationship of two variables. And if we look at the graph on the left, we're comparing the total population to the total death count. And it looks like there's actually a pretty strong correlation or strong relationship between those two variables. And that kind of makes sense. The more people you have, unfortunately, the more deaths you may have. But what's something to note is that correlation does not mean causation. And that is really emphasized with the graph on the right. The graph on the right is comparing the death rates to the total population. And this would be what we consider a much weaker correlation between a relationship between these two variables. And in fact, it is the total population does not indicate that you have a higher death rate. So in fact, the larger populations did not mean that we're going to have a higher death rate. So for the sake of the remainder of this analysis, I kind of took that variable off the plate a little bit as far as not needing to focus on higher populated areas. Just kind of thinking about what could be some of those reasons is in those metropolitan areas, maybe there's better access to healthcare or better healthcare systems in general, or maybe there's just lower percentages of those vulnerable populations. Maybe when people get to that retirement age, they want to head out of the higher densely populated places and be a little bit more isolated. So those were just maybe some ideas of what could contribute to that. So the next thing I looked at was really kind of identifying where we may need to be sending some of those additional staff members, where is going to have the highest impact. So I kind of looked at three main things. Number one was the total death counts. And as we can see in the graphic up here, that California really had the highest total death counts, which makes sense. It is a much higher populated state, which means we are going to potentially have much higher death counts. In comparison to, say, a Montana, which has a much lower population, there was a much lower death count. Some of the other things I looked at was death rate. And as we can see, New York actually had a pretty high had the highest death rate of 0.023 compared to California of a 0.016. And then even further compared to like a Montana, which was a 0.004%. So that was definitely something to consider when we start to look at some of those states that might be at a higher need of supporting staff. One other factor that I looked at was also just states that had a really high population of that retirement age. So that's 65 and older. And as we can see, that sunny state of Florida had the highest percentage of 65 and older population. In comparison to a Utah that has a pretty low percentage of an older population, which was interesting. So the graphic down below is really going to be important when it comes to the next phase of allocating where these support staff are going to go. This looks at the projection of potential death rate or death counts for our upcoming season. So for example, if I went ahead and clicked on California, it's going to show me how many potentially death counts we're going to have in comparison to like a Montana or let's say a Tennessee. We can also go ahead and break this up into different regions if we want to look at allocating resources per region as well. So what did this provide for us? To recap, there is definitely a flu season in those winter months. That vulnerable population is that retirement age of 65 and older. And additionally, the state's total population, does not indicate a mortality rate. So I'm not just looking at states with high populations. So my recommendation to the staffing agency, I tried to break the states and group them into kind of high priority needs. And that high priority need was based upon two things. Number one, the total death counts, as well as the death rates. So when you're looking at this graph in the bottom left-hand corner, the size of the boxes represent the total death counts, whereas the color represents the total death rates. So the highest death rates was like New York, like we saw in the last picture, along with Pennsylvania, Missouri, Tennessee, Massachusetts, and Hawaii. However, some of those bigger populations, such as California, Texas, Florida, are going to be some of those other states that may have that higher retirement age population, or just higher populations that might need some additional support as well. So that would be coming to a close of the presentation today and the recommendations that I have for moving forward with the next flu season. As far as the pipe dream of what I would love to do with this data in the future, and to further support the medical staff and our older populations, is to start to analyze the different vaccines and their effectiveness towards influenza, because ultimately we want to start trying to reduce that KPI, that 64 times more likely to die from influenza. We want to help people survive those influenzas, especially at that later stages in life. So I hope you enjoyed the presentation today. Again, thank you so much, and I appreciate your time. If you have any questions, feel free to reach out. Again, my name is Taya, and have a wonderful rest of your day.